আলাইকুম, আমাকে কি শোনা যাচ্ছে? হ্যালো, আসসালামু আলাইকুম, আমাকে কি শোনা যাচ্ছে? থ্যাংক ইউ কনফার্মেশনের জন্য। Assalamu alaikum. Welcome to BIIHR Journal Club presentation. It will be conducted by me, Sumaya Nazrul, a research fellow of Bangladesh Institute of Innovative Health Research. Topic of this session is the results of ultra-processed food consumption and weight change, a randomized controlled community trial in a health promotion program. Authors are Mariana Souza Lopes, Patricia Pinheiro de Freitas, and Ellen Christine Souza Lopes, and it was published on 11 February 2025, and this is the citation of this paper. Now we will move to the abstract. Objective. Our objective was to evaluate the association between ultra-processed food, UPF consumption, and body weight change after participating in nutritional intervention. Design. Our study was a 12-month follow-up of participants in a randomized controlled community trial setting, Brazilian primary health care. The participants were health promotion service users. Users in the control group performed the service's usual intervention, while those in the intervention group additionally participated for 7 months in nutritional intervention. Socioeconomic data, self-health, perception of time spent in health promotion services, and weight loss attempts were investigated. Food consumption was obtained by 24-hour food recall and categorizing these in quartiles according to the NOVA system of food classification. Weight was measured and changes in the 12-month period were calculated by subtracting the weight at follow-up from the baseline measurement. Results. The participants, 88.1% were females aged 56.7 plus minus 11.8 with 19.7 plus minus 15.3 months of participation in the service. In the fourth quartile, the percentage contribution of calories per consumption of UPFS was 47.7%, with no differences between the IG and CG adjusted after 12 months when comparing those with lower consumption of UPFS. Individuals from the second, third, and fourth quartiles had positive weight variation. Respectively, these variations were as follows: 0.363 kg, 0.467 kg, 0.389 kg, with no differences between IG and CG. Conclusions. The percentage contribution of calories from UPFS is associated with positive weight change, which contributes to the growing evidence of the relationship between UPFS and obesity. Introduction. Overweight is a major risk for chronic diseases and has become a global epidemic with over 1 billion obese people worldwide. Ultra-processed food UPF consumption has been linked to excess calorie intake, weight gain, and obesity. Defined by the NOVA classification, UPFS consists mainly of processed ingredients like fat, sugar, and salt. In Brazil, increased UPF consumption has contributed to rising obesity rates. Studies, including the Nutrinet Sante cohort, have shown a clear association between UPF intake and BMI changes. However, few studies have examined this link among public health system users. Brazil's Health Academy program, EAS, one of the world's largest physical activity initiatives, provides exercise programs but lacks universal nutrition interventions. The study explores UPF consumption's impact on weight change among primary healthcare PHC users receiving nutrition interventions, aiming to enhance health policies and guide global strategies. Overweight is a major risk for cardiovascular and other chronic diseases and has quickly become a global epidemic with more than 1 billion obese people worldwide. It has been consistently reported that ultra-processed food-based diets causes excess calorie intake and weight gain and may facilitate the development of obesity. UPFs are defined by the NOVA system of food classification as products formulated mostly on entirely formed food constituents not found in home cooking, which consist of culinary ingredients such as fat, sugar, and salt. In Brazil, the rise of UPF consumption has played a major role in increase in the obesity epidemic. In other countries, studies have also revealed the association between UPF consumption and body mass index changes. For example, a study with 110,260 participants, the Nutrinet Sante cohort study observed BMI changes in all UPF consumption quartiles followed between 2009 and 2019. The weight gain appeared to be higher for participants in the second, third, and fourth quartiles compared to the individuals from the first. The magnitude of the obesity problem and its association with UPF consumption has led to the understanding that UPFs are important in preventing and reducing weight gain. However, few studies of users of public health systems thus far have explored the role of UPF consumption in weight variation. Since 2014, Brazil's dietary guidelines have aligned with the NOVA classification, highlighting the need to study UPF consumption and its impact on weight change. Thus, the purpose of this study was to evaluate the association between ultra-processed food consumption and body weight change after participating in nutritional intervention to promote fruit, and vegetable consumption among the health promotion services of Brazilian primary health care users. Materials and methods, study design and samples. This study used data from randomized controlled community trial titled Assessment of the Impact of Contextual and Individual Aspects, especially ultra-processed food, consumption on obesity evolution in primary care users. Conducted in Brazil 2013 to 2017, the trial is registered under RBR 87 SSB. Study type, randomized controlled community trial with a 12-month follow-up. Participants 3,414 individuals from Belo Horizonte, Brazil. Two groups, control group 1,931 participants receiving standard care, intervention group 1,483 participants receiving additional nutritional education. Intervention, encouraging fruit and vegetable consumption to reduce UPF intake. The sample was drawn from 18 randomly selected PAS units in Belo Horizonte, Minas Gerais, Brazil, representing medium and high vulnerability areas. Participants were PAS users aged 20 or older who had engaged in physical activity within the past month, excluding pregnant women and those with cognitive impairment. Data collection. Data were collected at baseline and after 12 months through face-to-face interviews by trained dietitians and students. The questionnaire included socio-demographic information, self-health perceptions, physical activity, dietary assessment, and body weight measurements. Dietary assessment. Dietary intake was assessed using two 24-hour food recalls and on alternate days. Food items were classified based on the NOVA system. Focusing on UPFS, missing data on food consumption were inputted using multiple imputations and adjusted for socio-demographic variables. Outcome assessment. The primary outcome was body weight change over 12 months. Missing weight data were inputted using a method similar to dietary assessment. Covariates included age, gender, education, time in PAS, occupation, marital status, physical activity, weight loss attempts, and participation in the nutritional intervention. Nutrition intervention. The intervention aimed to promote fruit and vegetable consumption and reduce UPF intake. It included workshops, motivational messages, environment-based activities, and educational materials. Participants were categorized into subgroups based on their readiness for dietary change. Statistical analysis. UPF consumption was analyzed using quartiles of energy contribution. Weight variation were examined using t-tests and linear regression models adjusted for intervention group, baseline weight, and covariates. Statistical significance was set up at p less than 0.05 and analyses were performed using stata. Mean and standard deviations were calculated for all continuous variables and frequency was used to describe qualitative variables. Results. Data at baseline and at 12 months of follow-up are presented for all 3,414 participants who were reallocated to the control and intervention groups. We investigated 3,414 individuals, 88.1% female aged 56.7 plus minus 11.8, 7.2 plus minus 4.1 years of education, and with 19.7 plus minus 15.3 months of participation in PAS to determine the differences between the IG and CG. More than half, 61% of the participants had recently tried to lose weight. The general, control, and intervention group baseline characteristics by quarters of percent contribution of calories per UPF are presented in Figure 2 and Table 1. The mean contribution of calories per UPF consumption at the last quartile at baseline was 47.7% versus 9.7% at first quartile, without any difference between the participants in the control and intervention group with regard to differences between the total sample CG and IG. When we stratified UPFS by quartiles of consumption, we identified that individuals in the CG with higher consumption of UPFs were older, had a higher level of education, had a higher income, and no longer participation at time at PAS in comparison to their counterparts in IG. In addition, they had a lower prevalence of weight loss attempts. In Table 2, the mean of weight change is presented according to the user's quartile of contribution of calorie per UPF consumption among individuals in the fourth quartile with the highest consumption of UPFs. There was a positive variation in weight, 0.78 kg, with a difference between the CG and IG. After adjusting for confounding factors, individuals in the second, third, and fourth quartiles of UPF consumption showed significant weight increases compared to those in the lowest quartile. The observed weight variations were second quartile plus 0.363 kg, third quartile plus 0.467 kg, fourth quartile plus 0.389 kg. However, no significant difference was found between the control group and the intervention group. Here we can see the flow chart of this paper. It's the table 1 where the characteristics of the study population according to quartiles of baseline percent contribution of calories per ultra-processed food in a fruit and vegetable randomized control community trial is given. And Table 2, the mean weight change after 12 months of follow-up according to users' percent contribution of calories, kilocalorie per ultra-processed food consumption in a food and vegetable randomized control community trial. It's the Figure 2 where we can see the contribution of calories per UPFS. And in Table 3, we can see difference in body weight gain over 12 months according to the baseline users' percent contribution of calories per ultra-processed food consumption in a fruit and vegetable randomized control community trial. Now we will move to the discussion. Higher UPF consumption at baseline was significantly associated with weight gain among users of Brazil's Unified Health System Health Promotion Program after 12 months. However, the participation in the nutritional intervention did not show a significant impact on preventing weight gain. The positive relationship between UPF consumption and weight variation supports findings from previous research. The Nutrinet Santé cohort in France reported an increase in BMI with greater UPF intake. Similarly, the European prospective investigation into cancer and nutrition study, which followed 348,748 participants across 9 countries, found that a 1 standard deviation increase in UPF intake was associated with a 0.12 kg weight gain over 5 years. A Japanese randomized crossover study further reinforced these findings, showing a weight gain of 1.1 kg due to UPF consumption. In Brazil, a study of civil servants found that individuals in highest quartile of UPF consumption had a 27% greater risk of weight gain and increased waist circumference than those in the lowest quartile. UPFs are characterized by high energy density, saturated fats, trans fats, added sugar, and artificial additives while lacking fiber, protein, and essential micronutrients. Their widespread availability, convenience, and aggressive marketing contribute to overconsumption. Additionally, UPFs are often designed to be highly palatable, potentially leading to addictive eating behaviors. Some research suggests that food additives such as emulsifiers may disrupt the gut microbiota, increase intestinal permeability, and trigger chronic inflammation, factors linked to obesity and metabolic disorders. Despite the intervention's focus on increasing fruit and vegetable consumption, it did not significantly reduce weight gain among participants with high UPF intake, while consumption increased by 23.4 gram per day and fruit intake by 17.3 gram per day. Among those with low baseline intake, an improvement was not sufficient to counteract the adverse effects of UPFs. This suggests that merely promoting unprocessed food consumption may not be enough to reduce UPF intake or prevent weight gain. Future studies should explore more comprehensive dietary interventions that address both increasing healthy food consumption and actively reducing UPF intake. These studies' strengths include its longitudinal design, use of direct anthropometric measurement, and assessment of UPF intake through multiple 24-hour dietary records with home measurement kits. However, limitations should be considered, such as lack of long-term weight history, absence of data on past weight fluctuations, and potential confounding factors like bariatric surgery or medication use. Additionally, the study population individuals engaged in a health promotion program may be more health conscious than the general population, potentially limiting broader generalizability. Despite these limitations, this study provides important insights into the association between UPF consumption and weight gain among Brazil's unified health system users. Given that over 80% of Brazilians rely on this system, the findings have significant public health implications. Future research should further investigate the causal mechanisms behind UPF-driven weight gain and explore policy-driven strategies to reduce UPF consumption and promote healthier dietary behaviors. Conclusion. In conclusion, greater UPFs consumption at baseline was associated with weight gain in users of Brazilian PHC. The nutritional intervention based on encouraging the consumption of unprocessed foods does not seem to be sufficient in preventing weight gain due to the excessive consumption of UPFs. This may indicate that the peculiarities involving the consumption of UPFs, such as unfair marketing, prices, and compositions, need to be worked on with an outlook towards shifting the consumption of UPFs to fruits and vegetables. Thank you, everyone, for joining this session. If any of you have any question, you can ask.
থ্যাংক ইউ সুমায়া নজরুল আপনাকে। আপনাদের কারো যদি কোনো কোয়েশ্চেন থাকে বা কোনো ধরনের জিজ্ঞাসা থাকে সুমায়া নজরুলের কাছে আপনারা করতে পারেন।